share the recording with your professors as well, okay? So you guys can review this, and I don't require you to be on camera if you don't want to. I did a PowerPoint again because I like to do those. I think they're helpful. Unfortunately, I can't share them, but if you want to review my PowerPoint, you can always just watch the review. I know you don't want to hear my voice multiple times, but that's really the only way we can do it. All right, so I have a PowerPoint for you. It's going to go hand in hand with your study guide, sort of. And we'll take a look at some of the topics that'll be there. And oopsie, and I'll get my slideshow going for you guys. All right, so first thing we look at here, let's do a slideshow so it's bigger. And what we see is our rural population, right? We see poverty in our rural communities. The groups at highest risk is going to be our kids, right? And among our racial minority groups, our Hispanic rates are the highest, okay? So two big things to remember with our rural community. Poverty at highest risk is going to be our kids and our Hispanic population. Our number of college degrees far lower than our urban residents, our city people. And why do you think that is? What do you think that does for unemployment? The lower your education, what happens to your availability for economic growth in a career sometimes? Anybody know?
Less access to education or
Right, so the lower your education, remember this is our social determinants of health from the beginning of the quarter, right? So the lower your education, the less opportunity you have in the workplace, okay? So remember, a college degree is going to be less. I want you to think about a rural community. You know, these people are way out. They're not in the cities. They're in areas where you won't have access like you would in a city, okay? So then we look at our migrant workers, right? And I gave you some pictures here just to look at. So we're going to have our physical demands in our harvesting crops. It's going to be hard on the musculoskeletal system, 12 to 14 hours a day. We see back and neck pain. We see sciatic pain. We know for sciatic pain, just as an FYI, that we're going to see, is it aggravated by any increase in intraspinal pressure, like bending, lifting, sneezing, coughing, those kind of things, okay? So we look at our rural population. We also want to remember, in our rural communities, what do people feel about each other? Do they feel like they know everybody or they don't know everybody?
they're very tight-knit.
Very good, very tight knit. And I show you this picture because think about it. If you live on a farm and the next farm owner is, 5 miles down the road, you two are the only neighbors, right? So you're going to know everything about each other. So they're less likely to do stuff in their free time, less likely to do safety precautions. Big deal here is their chronic illness is going to be higher, right? Chronic illness higher in our rural populations. Why do we think that may be?
They're far from a hospital. They probably don't, want to, yeah, just far from a hospital.
And not just the hospital, doctor's offices. Think about it. Not a lot of doctor's offices out there, right, in these rural communities. So they're going to have more chronic diseases, maybe due to lack of their PCP going every 3 months or 6 months or whatever you have to go, right? All right, know that there's a lack of anonymity among our rural communities. So we always worry about abuse. We worry about reporting things because they don't want to be seen as they don't want the whole community to know. So we're going to see less reporting of sexual assault, drug abuse, and depression, any mental illness, right? In our rural communities, everybody wants to keep it to themselves. Let's skip that one. Identify health risks. I'm going to re-emphasize to you that they're less likely to participate in leisure activities, and chronic diseases are biggie in rural communities, okay? If we look at some primary and tertiary prevention regarding pesticides, because we know pesticides is a big one. So to prevent exposure, a primary intervention for the nurse would be teach workers how to reduce their exposure before they're exposed. We're going to provide hand washing stations and conduct screening such as urine testing as our secondary. And then our tertiary is we're going to be treating those nausea, vomiting, and skin irritations, right? So it's going to be our primary, secondary, and tertiary with our pesticides. One culture that we will talk about, I want you guys to be familiar with, is our Mexican culture. And these are our regular guidelines for them. The nurse is going to be considered as an authority figure. And they expect you to chit chat with them. So you have some personal things. Touching's fine. They don't worry about that. They want you to really be like one-to-one with them and really share some of your experience and they with you. All right, we have our families with homeless, fastest growing community of the homeless population is our families with kids. It's very unfortunate, but that's where we're at. We know single motherhood is increasing in our homeless population. We talked about education and poverty. Poor teens are most likely 3 more times likely to drop out of school than their non-poor counterparts. So it is very important with our pregnant people, pregnant teens, we keep them in school. Because if we don't keep them in school, what happens?
They might end up homeless or just
Less
risk for other.
opportunity, right? Yeah, less opportunity. And if we are dealing with our homeless and they have a wound, what are we going to do for those wounds? We're going to make sure we give them the stuff to keep it clean because they're not going to come back for follow-up care. So we're going to try to give them whatever we can to help keep their wounds nice and clean, right? Where do we know our homeless get health care?
Community clinics? Or-
So we actually see them in the ERs. Anybody who works in
Okay.
the ER, you see homeless people all the time. So it's not that they don't come in for medical things, but a lot of times they come in for a warm place to eat. So I want you to think about that, where they're going to keep warm and to get some food. So know that we see crisis-oriented care. So, so the cost of service is very high for the homeless because there's a lot going on with them, but they don't usually have insurance. So that's part of our problem, right? They're at high risk for risk-taking behaviors like onset of early sexual activity, communicable diseases, alcohol and drug abuse, right? All right, this is kind of a review. You guys should know this at this point, but what's going to make somebody vulnerable for HIV? We think about individuals who have used IV drugs, individuals who have experienced persistent and recurrent STDs, multiple sex partners. These are high risks. So if you were taking a test, there might be a question about what's going to put somebody at high risk, okay? Maybe a teenager, maybe a homeless person, who knows? All right, big thing with our youth. We see this is part of a way to prevent youth violence, and unfortunately that's seen all over the world. How do we prevent that youth violence? We increase their social skills, okay? So big thing for our teens, up that social skill. So give them training on how to interact, okay? So that they stop, think, and act. We see peer pressure is huge, and media violence is impacting our adolescent violence. So think about what they're watching on their phones and what they're watching on TV, and then their friends say it's okay, right? So anti-bullying and conflict resolution are things that are going to help with this. Okay. All right, alcohol and drugs. You have several questions on your test about this. I will tell you that. So let's pay attention to this section, and you guys know it. What kind of things are we going to worry about mixing barbiturates with?
Like downers, like an opioid or like a benzo or barb.
Yep. Any alcohol, you're not going to put alcohol with that, right? Is it going to depress the central nervous system? We don't want to double depress it, do we? Okay, so think about our physiological dependence with our chronic users. There are risk factors like violence, trauma, genetic connections, and mental illness. All of those. We know history of violence, history of trauma, history of mental illness, and genetics, family history of abuse we're going to see, and family history of drug use. So it's always really important when we're looking at our communities, what drug is being used and how does it impact them, right? Because all the drugs are so different. So you have to make sure you're dealing with the right one, right? So what dangers would we teach about vaping with products and exposure, particularly for parents? What do we know about vape oils?
The oils are dangerous for kids.
Yeah, they can be poisonous. Very good. So what are we gonna do for smoking prevention or vaping prevention? What kinds of things are we gonna teach? Who are we gonna teach to?
The
I'm gonna
period.
let someone else answer because I feel like I'm
And
answering too much.
smoke
You are
outside
answering a lot, but it's okay, Marcia.
of the house
Good, smoke outside the house, what else?
to keep the products away from small kids.
Yep. And we're gonna make sure that if they're smoking, we can give them smoking succession classes or things like that, right? Big thing on our the way we determine secondary screenings on our drug and alcohol users, we're gonna use a behavior risk factor survey. What that does is it lets us know who's at risk. Okay, so for secondary screening on alcohol and drugs, we're going to do our behavior risk factor survey. That's just saying what risk factors do you have? Okay. Marcia, it's okay that you're answering all the questions. At least somebody's answering. It's okay. And Diane, thank you for answering. All right, we have our two different things with congregational and institutional based parish nursing. Oh, my voice today. Congregational, we're focusing on that one community, right? So take care of one large group all on your own. You're very autonomous with congregational. Institutional, you kind of work with a bunch of people, you intermingle with them, and so you're going to act more as a liaison between the church and some providers. So we're going to be a little less autonomous with our institutional parish nursing. Okay. You will have some questions on nursing care plans and the nursing process. So initially, when we're looking at goals, we're trying to figure out what outcomes are we looking for. So in order to get to our outcomes, we have to look at the goals first, right? And that's our first thing. So when we're looking at goals, we're really looking to figure out what are we going to come out of this with, right? And we do this mutually. So we do it with the patient. We discuss health problems and limitations as part of our assessment, and planning occurs after outcomes have been identified, right? So that our goals have been set, and so everybody's on board to have the same outcome. So very important, looking at goals, come to our outcomes, and after we have our outcomes identified, then we can do a plan, right? You have a question on there about Medicaid and Medicare. Client must demonstrate the need for nursing skilled care. Okay, so caring for a new wound is an example of Medicare coverage, but ADLs, sitting services and activities of daily living, Medicare is not going to cover. So you got to be something nursing. So if the question said something along the lines of a patient with needs help changing their clothes daily, would Medicare cover this? Yes or no?
No.
No.
No. Good. All right, difference between the two. Medicare 65 and older, Medicaid is based on lack of financial funding. I'm going to re-emphasize again, Medicare will only pay for home health cares by skilled professionals while they are homebound. They have to be homebound to get the coverage. And Medicaid does not necessarily require homebound, and they may reimburse for health aides. So some of our older people, you'll see they'll have both. So they'll go from Medicare to Medicaid because financially they can qualify, and Medicaid will cover some more services. Okay. We talked a little bit about hospice care. What are we looking for in hospice care? Just give them comfort, give them care, give them love, you know, in an appropriate manner, of course, but you know, you give them what they need, right? I have to make sure I'm recording because boy, if I'm not recording. Yeah, I'm recording.
You are.
Okay, thank you. I just want to make sure because boy, that would stink if I didn't. Okay, epidemiology was this week's chapter. We know it's a study of the distribution of factors that determine health-related events, right? So we have analytical, which is going to look at why, our origin, our causes of the disease, and then deal with the determinants of, like, how does it occur? Why are some people affected more than others? That's our analytical, okay? We're analyzing the studies, okay? So just know those two terms. Those are good terms. We have our epidemiological triangle, which is very important. We have 3 factors: host, environment, and agent. I always tell people, remember HEA, HEA. Host, environment, and agent. Our host is going to be that person, that animal, whatever, that is going to be taking it in or hosting our agent. So our agent's going to be that bacteria, that viral, poison, alcohol, trauma, whatever it is. And then our environment, we talked about this, crowding and water and all that kind of stuff and how they impact. The goal of the epidemiological triangle is to cut the triangle. Okay, so you want to try to do something to make sure your host and environment don't connect, or your host and your agent don't connect, right? And we talked in my class about COVID, but this is a good example. But like, you know, if you have a susceptible host, you want to keep them away from that agent, right? And if they're living in a compromised environment, that's going to make this whole triangle work even better, right? So think about that when we look at epidemiological. Important definition, please know this one. The case fatality rate is the people, portion of people diagnosed with a particular disorder who die within a certain time period. So often people will say, what's my probability of surviving, right? When they're diagnosed with something. And that's your case fatality rate. Just remember, cases that die, rate. Fatal is die and rate, okay? I feel like I'm going through this so quickly, but environmental nursing, reduce, reuse, recycle. Remember your 3 R's, right? We look at how the environment impacts our health. It impacts it several thousands of ways. Air pollution, inadequate water, chemicals, climate change, agricultural practices, work. So all those kind of things, they all impact how we do overall. Our respiratory system, going to be impacted hugely by environmental health with traffic congestion and air pollutants. Okay, there may be a question about who's at highest risk for illness after contaminated food or water. It's going to be those people that don't have a good immune system, right? Those people kind of make sense. If they don't have a good immune system, they're going to have a hard time fighting off contaminated food or water. We have different studies. This is sort of a piece of epidemiology. I just like to do this separately. So one study we have is cross-sectional. So it gives like a general cross-section of popular group. We get this information and then we can look and see how did these people get it. So we look at previous data really and potential risk factors and exposures. And that will be a cross-sectional. So we look at the population and say, were they exposed? They get the disease? Were they not exposed? Or they exposed and got no disease? Were they not exposed and disease? Were they exposed and no disease? Okay, so we look at all those different factors. Retrospective is another type of study. And a retrospective, I always like to tell people retro, think of retro, back in the day, right? So these studies rely on existing records, so stuff that happened already, and then followed over time to determine if the outcome occurred. So just always think of retro, like retro clothing, retro hair, retro studies, okay? Occupational nursing was a chapter that we covered this week. Specialty focusing on preventative healthcare, health promotion, and health restoration within a healthy environment. And that healthy environment, we had a couple questions on the Kahoot that we did. Remember that healthy environment is the workplace. So we're not going to worry about people and their home life. We're going to worry more about what's going on in the health in the workplace. Okay, so work in traditional manufacturing, industry, healthcare, construction, and government settings. Okay, any questions on occupational nursing? It's really a nurse that takes care of somebody who's working. And that's the end of my thing. What kind of things would an occupational nurse do?
They do like drug screening at a job site, checking to see if the safety features are in working order.
You're
What else are they gonna do?
checking for if workers are wearing correct shoe.
Shoes. Ergonomics, don't forget, how are people standing? Are their desks at the right level? Right, a lot of people have trouble with their back and their neck because they sit at a desk that's too low or too high. Right, standing desks is a big thing that they promote. So I feel like I went through that kind of quickly, but
An occupational nurse kind of act as the buffer before OSHA steps in and starts raining down on their parade.
so occupational nurses will really deal with OSHA directly, yes.
Yeah.
They're
So they
really the
kind of
ones.
make sure there aren't any OSHA violations when they walk through that place.
Exactly. And so occupational nursing, like I said, I want to reemphasize, they're not going to be worrying about like chronic illness. They're not going to be worrying about that. They're going to be worrying about what are you doing in the workplace and what are you doing in the workplace? Is it safe? Okay, so just be careful with that. And so I like the way you said that. Think of OSHA with these guys because they both start with O, and occupational is really just that. Okay. On your study guide, were there any questions that I didn't cover in the PowerPoint? I know I went through it quickly. I don't know why, because this was a quiet group except for a couple. Thank you. But I know it's the end. It's late for you guys too if you're East Coasters. You will have 5 math, as always. Multiple choice, you'll have a bunch of select all that apply. A good study technique, I would say, is just go over my PowerPoint and go over your study guide. I try to really emphasize what I want you guys to know to make it easier. Here, hold on, I'm going to do one more thing. Just give me
Hey, do the chapter PowerPoints, are they?
Yeah, they're good review. They're a good
good?
review.
Okay.
I mean, I wouldn't spend it. I hate to say that. They're good review. They're good content review. So it can't hurt. I would, if I were you, I'd focus on these reviews because we help write the test. So we kind of know what we're focusing your learning on. I'll tell you though, that there's going to be some questions on primary, secondary, and tertiary. So please remember those 3. You're going to see that all through the quarter. So remember with our young kids, I'm going to re-emphasize a couple factors, okay? Young kids, teach them social skills that'll cut down on our violence. We see our homeless getting their care. Where do we see it? Where do the homeless get their health care?
The hospital, emergency.
The emergency room.
Emergency room, and that makes the cost high, right? Everybody knows how much emergency rooms are if you have insurance. So imagine if you don't have insurance, what kind of cost that is for our healthcare facilities, okay? That's something I emphasize. Behavior risk factor survey. Right? That's for our drug and alcohol use. It's going to put our secondary screening in there. Seeing who's going to be at risk there. Remember, secondary, we're always going to be screening, right? Secondary is always going to be screening. So if you see a screen question, you know it's secondary, right?
All
right.
I
Yep.
can't remember. Do you guys have Cahoots out there? Were there some I saw
Yeah.
in the email? Are those?
Yeah.
Those are pretty good, aren't they?
I would agree. Those are good.
Yeah.
I'll send it out to my class, Diane. I don't, it's an exam Kahoot, right?
Yeah,
I
it's the
just-
exam 2 Kahoot. And there's
Okay.
also a week 4 and a week 5 Kahoot that
Yeah.
Professor Price.
Price. I
Yeah,
gotta find it. Yeah, I know it's somewhere. I gotta
yeah,
find
we
it.
did
So-
that last night, and I know the one for pediatrics, the Kahoot was a lifesaver for that exam.
Wasn't.
Yeah.
Right. So I wouldn't say it's a lifesaver to do them. I
They're
will tell
pretty
you
good.
that, but I will tell you that we as professors create them. So kind of, you know, try to put good stuff in there. Don't forget if you see any violence on a kid, right? What are you gonna do? What's your priority?
You contact social worker.
Child Protective Services.
Right, report it.
Yep, we're mandatory reporters. Who's our fastest growing homeless population?
Families with kids.
Very good. Unfortunately, you can remember that because it's sad. It's very sad to me, that part. We see increase of acute or chronic illness with our rural communities.
Chronic.
Chronic.
Chronic. Yep, remember those chronic things. With our Mexican population, we want to do what kinds of things?
Chit
Talk with
chat.
them.
Touching is okay.
They're gonna see you as an authority figure.
Yep. So they're going to listen to what you say. So be careful the way you speak, right? Because you could say something and they misinterpret it, meaning you meant one thing, they meant something else. So you want to really be careful with your wording, right? Case fatality rate. Anybody remember that one?
Yeah, it's the you're determining uh, people, um, the particular, what do I have here?
It's okay. So just think of fatal.
People, yeah, people like who's dying
Right.
from having this
What's the
disorder.
chances? Yep. So what's
Yeah.
the cases? Like, so think about what are the case numbers of dying, really, is how
Right.
you can translate it in your head, right? That's something I'd like you guys to know. So people will say, what's my chance of survival? That's a big question that you'll always hear.
Yeah.
Let's see what else. I'm just re-emphasizing for you guys since I know I went through this fast. 3 R's with environmental health: reduce, reuse,
Recycle.
reduce. Unfortunately, we're not doing so good with recycling in this day and age, which we should be, but let's see, we're gonna make sure. Oh, this is a good one. If we're in somebody's house, what are we gonna worry about?
Safety.
Yes, what else?
Respect in their home.
Say that again.
Respect in their home.
Yeah, absolutely. We're going to respect the home, but we also want to think about something, and this goes back to the contaminated water that I spoke of. If people are compromised in their home, if they're like a hospice patient or something, and they're compromised and their food is bad, they're going to have a worst case scenario go on. So for this community, we're going to make sure fridge is working, food isn't expired, right? We're gonna check that kitchen out, make sure that the oven doesn't stay on, right, when we leave. But big one we're gonna look at is like, are the appliances working? Is there food fresh? Because if it has contamination or it's bad, then you get contamination, right? If the fridge doesn't work. So you want to really check that fridge out on our hospice patients because they're more vulnerable to get sick from stuff like that. Oftentimes kids, like Hep A, kids will usually be asymptomatic on that. So just think about that. What else? Our newbies in occupational health nursing, our new employees, we're gonna spend a lot of time teaching them, right? Because we got to make sure they know everything. Important with drug use that we know what the drug is, what are they using, right? And what its effect is. One question that I want you guys to know about. What are some things we will do if somebody's in alcohol withdrawal? What are we gonna do for alcohol withdrawal?
Seizure precaution.
Say that again?
Seizure precaution.
Yeah, seizure precaution, yep. What else?
Monitor their vital signs
Yep.
and
What else?
medicate.
Monitor vital signs, good. What else?
Did you medicate them?
You wouldn't medicate them. You could administer meds, right?
Right.
But the doctor would medicate. We're going to make sure that we keep them safe, right? And what kinds of things happen other than seizures? Does anybody know with alcohol withdrawal?
Aren't they diaphoretic a lot? They go
Yeah, they
diaphoretic.
sweat a lot.
They get tremors, nausea, vomiting.
They
Um,
also tend to have hallucinations.
yeah, I was just gonna say they will see stuff that isn't there.
So you want to be careful if they have hallucinations, we want to make sure that we're being kind to them, but just being therapeutic, right? And letting them know that they're safe and providing, orientation for them. Like this is where you are and this is why you're here. Because they would get very disoriented, right? Let's see here. All right, we know two big things that cause youth violence that we're going to think about their phone screens, right? And what else?
Your social skills.
Yeah, you're gonna work with social skills, but we also know peer pressure, right? Peer pressure creates violence. The kids put something on, if anybody has kids or knows kids, TikTok, they put something on TikTok and everybody wants to repeat it. So that's peer pressure, right? And it's videos that they're watching. Let's see here. All right, our congregational nurses and our institutional nurses, what's their goal? Their goal is really to do some preventative care in that facility, right? Want to make sure they're doing some prevention. We're going to make sure we're respecting our clients and their spiritual beliefs, whether we believe it or not, right? That's really important.
Yeah, about that, you touched on that with the congressional
Congregational.
nurse
Mhm.
really just dealing with the one community, that
Mhm.
congregation and that little populace, but an institutional nurse, they're dealing with the church and who?
And they're going to involve other people. So they're not just going to deal with the church. They're going to involve like services in the community. They're going to involve hospitals that are local. They're going to call the nurses and say, hey, I have this patient that has this. They're coming in for this, that kind of thing. So they're going to involve a lot of people. So they're not all by themselves. Okay,
So
so
which one falls under the parish nurse?
both of them. There's two
Both
different
of them.
types.
So
Yep,
there's
two different types.
of
That's a good
parish
question.
nurse. Okay.
Mhm. So one is very autonomous, right? They just work with that congregation, that's it. The other
Mhm.
one's working with a bunch of other people, so they're less. So that congregational nurse, it's just them and the congregation. Does that make sense?
Are they both focused on the spiritual side of,
Mhm.
both of them?
Mhm.
Okay.
Yeah, but you know, they're nurses, so like all of us who are nurses, we know we deal with spiritual, but we also always deal with everything, right? Because that's part of what makes us who we are. So think
Okay.
about that. But yes, they're both involved with spirituality and religion, however that is, you know. Let's see. Mm-mm. When we're looking at air quality, that's going to be important. We know that we look for traffic congestion is a big one. So we're going to make sure that there's alternate methods, like so that there's buses, right, to cut down on the number of cars. There's trains to cut down on the pollution, that kind of stuff. Our respiratory health is big with environmental health, right? Because our air pollution, we get that from all kinds of things, right? We get it from cars, we get it from buildings, we get it from factories, we get it from everywhere. Okay, so those are just some things that I'm overemphasizing with a purpose. Okay. All right, any questions for me at all? I will post this review later tonight for your professors, okay? All right, best of luck. This is our second exam, so we're almost 50% there, okay? So keep your head in the game. We're getting there, right?
Yeah. Thank you.
Thank
All
you.
right, good
Thank
night.
you, Professor.
Thank
Yeah.
you.
You're welcome. Good night.
You.
Thank you, Professor.
You're welcome.